We also have the responsibility for administering the medical dental plan of the United Church of Christ. There's a lot of interest in and conversation about healthcare reform. That is a 2010 report, so as we gather next year, we'll talk about the implications of healthcare reform. We'll talk more about that. I'll make a brief comment about that in this segment on the health dental plan. But for the benefit of this slide, at the end of 2009, it marked 7 consecutive years that the health plan had been below trend. Trend is what is aggregate in terms of healthcare, what is known as the increase of cost, and it has 2 components. One is utilization, how much healthcare we consume, how much healthcare we utilize, and the other is inflation. What is the cost that is going up? Utilization and inflation. Utilization drives about 2/3 of the increase in cost of healthcare trends. So when you hear broadly, nationally, that healthcare is going up 10–12% a year, about 2/3 of that is we're using more healthcare. We're consuming more healthcare. We're going to the doctor more often. We're having more tests, et cetera, et cetera. About 1/3 of that is really the cost of inflation. So as an education moment, when you talk about trend, that is really the measure of healthcare increases. For 7 consecutive years, and we're into the 8th year now, the UCC health plan has been about half trend. Trend nationally has been between 8–12%, really over 10%, and we've been under 5% for 7–8 years consecutively, which is a very difficult thing to do because among the top 25 plans that report in the Church Benefits Association, we have the oldest population of members in our health plan, and as we age, we consume more health care, we utilize more health care, so therefore how is it that we're able to be below trend? It's a very difficult challenge, and I'll have a couple of slides that will talk about that. But the net effect of being half trend for 7 years consecutively is a savings of $15 million, meaning had we been just at trend, what the trend of healthcare increases for the last 7 years, our church employers would be on aggregate paying $15 million more in healthcare premiums. So as expensive as the healthcare plan is, we would be paying $15 million more had we been just at the national trend. The rates, for example, for 2010, as it was calculated in 2009 for non-Medicare, that's our active plan, increased 5.2%, Medicare increased 4%, and again, these were about half for the 7th, actually going into the 8th consecutive year. One other thing that was started in 2009 was a complete review of the Medicare supplementation plan. So we have a plan on the medical side for our active members, we have a plan for our retired members, and we looked at the retired plan with a focus group made up of some of the folk in this room for over 9 months. Is this plan really a cost-effective plan? And the results of that study was you can't really replace that plan in the marketplace at the same cost. It is the most cost-effective, very deep, high coverage, deep coverage plan, and there's nothing in the marketplace available quite like that. So we were very satisfied that the Medicare side of the plan, Medicare supplementation side of the plan, is a cost-effective plan. Now how we do that, the next couple of slides will show, is we're part of a coalition with Medco as our pharmacy benefit provider that has 170,000 households in it. We have in our plan about 6,000 households, but we buy drugs as if we're part of a group of 170,000 households. And this is kind of a breakdown of the calculation is done on a per member per month basis. But the important thing is that in 2009, the net increase per member per month was about 5%. Pharmacy represents about 28% of our total medical costs, and the trend on pharmacy is double the trend on medical. And so this is quite extraordinary that we're only 5% increase on the pharmacy side in 2009, and it consistently has been that way because we are part of this coalition that is purchasing pharmacy benefits as if we were 170,000 households rather than the 6,000 households that we have. We also have on the medical side a coalition of 11 different denominations that go with Highmark Blue Cross Blue Shield. And this, I don't want to go across who's the front, but GS's Guidestone, that's the Southern Baptist Cadet Pension. BOP is the Board of Pensions at the Presbyterian Church, and you'll see we're third in terms of the size going down of participants in the plan. But if you look at UCC, and you kind of shoot up to the percentages, the savings, because we're part of the network of a group of 115,000 households, which is this group, that our aggregate savings was 47%. And if you go across to the side and you look at what the net effect of that is, the savings percentage range, but if you look above that, the net effect of the savings, total savings of over $400 million this group had, because we worked together as a collective church and negotiated medical benefits. So the combination of the medical, this slide, and the pharmacy side below, this is what helped drives the fact that we've been half trend for 7-8 years. So how we work as the collective church to get better outcomes has achieved those results in spite of the fact of our age, and that we are utilizing or consuming more and more health care. Embedded in our plan are a number of management rules. Some of those with respect to the drugs that you use and the like, and how the therapies that you need to go through in terms of how we really manage the plan. But also that's inside of the plan is something that members don't even know, and that's a safety piece. It's called Rational Med. We get about 200 alerts a year where a member may have a variety of different drugs that they take, and there's a drug interaction, about 200 alerts a year, and those alerts will they will fire off a notice to the doctor that, did you know this member is taking another drug, and that there'll be a conflict. And of those 200 alerts each year, there are 2 to 4 that are life-threatening. And that's an example of one alert. Person, 45-year-old woman, diagnosed with irregular heartbeat and depression, and they had prescribed a medication. Before that medication was administered, the bottom line is that this could have been potentially life-threatening. The point being is embedded into the system are a variety of rules that manage the health care and how the medication and drugs and medical are administered, but also a number of safety. And this is an example. Each year we'll be notified of 2 to 4 that could have been life-threatening. We actually just potentially saved lives. And that again is part of our health and medical plan. And then lastly, this is a real slide. This isn't a joke. This is healthcare reform, and this is what's happening between 2010 and 2018. We are a grandfathered plan, so we're kind of the gray shaded blocks. We have a set of things that are going into effect by October of this year. But this is a significant amount of staff time working on what does healthcare reform mean for the UCC health plan, and we're working again with our partner denominations on a variety of things as it relates to how do we interpret and communicate healthcare reform as it relates to our member base, and we're on it. But it's a very, very complicated process. A healthcare reform law that went into place that was put together in a way that did not have quite the orientation and the coordination that needs to be in place, and there are several of us working very hard on that. In our board meeting that will be following this annual meeting, we'll get into this in some detail. So again, I talked about the accumulation benefit plan, the annuity benefit plan, the health benefit plan, and lastly we have a life disability income benefit plan. We have about 5,200 lives participating, over $157 billion of insurance in place. The cost of this for a local church employer is 1.5% salary. So if there's a $40,000 salary, 1.5% of that, about $600 a year, you receive a death benefit, short-term disability, and long-term disability. It's the biggest bargain in the market. Replace that in the commercial market is about $2,500. And so this is quite a bargain for our local churches to have a broad range life disability program. And then folks are able to buy some additional death benefits should they wish to do so. We have about another $58 million of that in force, and then dependent additional benefit for dependents as well. Also, we provide the capacity for flexible spending accounts where churches can have, their employees can choose to have their certain amount of their benefits deferred in an account up to $5,000 per year. There's a one-time fee of $100 for a church to set this up. There's no administrative fee if the church employee is part of the UCC health plan. And currently we have 397 persons that are part of that. That again is a bargain that we just provide to the whole church, these flexible spending accounts that can save significantly in taxes. And the net effect in saved taxes in 2009 was $135,000. So persons would have had to pay, these 397 folk would have to pay an estimated $135,000 more in federal income tax had they not had this option. And so we have the four, again, benefit plans have the responsibility for administering. And then lastly, as I mentioned previously, we have a program of ministerial relief. The United Church of Christ is similarly charged with providing a program of ministerial relief, and for over 100 years has been doing so through the administration of the Christmas offering, and then also through dollars and income that we have from endowments. And you'll see the net effect of what we're able to do in terms of gifts to low-income clergy members, or emergency grants, supplementation of small pensions, supplementation of healthcare premiums. Those dollars total a little over $4 million a year. So we provide assistance and relief in a variety of ways in the amount of about $4 million per year. And then in 2008, we began thinking about a program called the Target 2030. In 2009, we completed all the work on that, and we've launched it on January 1, 2010. And this is a way of really reaching out to younger clergy. Most of the relief and assistance has been on the back end of ministry. How might we put something on the front end of ministry? So the focus is on 2030 clergy, and to do something over a period of time to 20-year horizon of really providing assistance support on the front end of ministry. And that program is launched. We're excited about it. Ministerial Assistance Corporation at this meeting will be talking about that at some length. We've identified in an application process 35 young clergy that have already applied through a very soft rollout of this program in 2010. And this you'll be hearing a lot more about at the next annual meeting of this program as we're just getting this launched in this year. So that concludes my report, a snapshot of what we do and how we do that.